Hi everyone, welcome to our live session today. As you probably knew, we will be giving out two free fertility screening package worth 218 today. Yes, you heard it right. It's a fertility screening for both husband and wife, including semen analysis and hormone tests, with a total value of 218 ringgit. So how to win this? You just need to stay and participate in our live session today, asking questions, liking our post, sharing our live video, or organize a watch party. We will be selecting two lucky winners at the end of the session. Our topic of the day is social egg and sperm freezing. We are very glad that our specialist could give us more information on this topic. So let us give a warm welcome to our first speakers of the day, Dr. Chong. Hi, Dr. Chong.
Thank you, Michelle. Hi, everyone. I'm Dr. Cheong. In the next few minutes, I'm going to explain to you about social egg freezing or pembekuan telur lengtung 卵子的服务. So what is social egg freezing? It means a woman can take out their eggs and freeze them, and when they are ready to get pregnant in the future, they can use these frozen eggs to achieve a pregnancy by undergoing fertility treatments. Why is it needed? Unlike men, when sperm production is an ongoing process, for women, when a baby girl is born, all the eggs are already in the ovaries, which means when we are 40 years old, our eggs are also 40 years old. So the older the woman, the older the eggs, the poorer the egg quality, and therefore the lower the pregnancy rates. So if a woman has a chance to freeze their eggs at a younger age, say 35 or below, even if they delay their pregnancy plan later on until the age of 40, 40 plus, but by using the previously frozen eggs, they can still achieve a good success rate similar to a younger lady. We're going to show you these two diagrams, which will illustrate how older female age can negatively impact both natural pregnancy and IVF pregnancy rates. So if you look at this diagram, at the age of 26, the chance of having a baby per month naturally is 25%. And it drops to 16% at the age of 34, and it drops even further to only 4% at the age of 40. In the next diagram, you will see a similar trend in IVF pregnancy. So the next diagram, you will see how. Next diagram, please, Michelle. The next diagram, if we take an average rate of 30 to 40%, you can see that at the age of 35, it starts to decline. And it drops even more rapidly at the age of 40, and is almost 0% at the age of 45. So if somebody is worried about they are not ready to get pregnant yet, but at the same time worried about having a low pregnancy chance when they're older, then social egg freezing can help. When is the best time to freeze your eggs? The answer is best to do it before you are 36, when your egg quality is still good. And how do we perform egg freezing? The woman needs to receive daily hormone injections to help the eggs to grow. And it usually takes about 10 to 12 days of injections. And when the eggs are ready, we will perform a very simple procedure called the egg collection. And the collected eggs will be frozen for future use. In other words, the woman goes through the same treatment process as IVF or test tube baby, but only until the stage of egg collection. Apart from social egg freezing, we also provide freezing services for medical reasons for both eggs and sperms, and which you are going to hear about it next. So in summary, social egg freezing allows a woman to freeze their eggs when they are younger, even if they delay their pregnancy plan until later on in life. By using the previously frozen eggs, they can still have a good success rate similar to a younger lady. With that, I'm going to end here. Thank you very much for watching.
Thank you very much, Dr. Chong, for sharing us these important points. For now, let us welcome Dr. Hatta, which will come to share with us our next topic, which is frozen sperm. Hi, Dr. Hatta.
Hi, how are you, Michelle? Hi, how's everybody? Yes, thank you, Dr. Chong. Dr. Chong has just now touched more on social freezing, and I would like to talk a bit more on medical freezing and more on the sperm freezing. So, why do sometimes men freeze their sperm or store their sperm? There are many reasons, but the commonest reason is, of course, if you have cancer, you may want to store your sperm before you start the cancer treatment. As you know, those who undergo cancer treatment will undergo treatment like chemotherapy and radiotherapy, and this may lead to decrease in the quality and the quantity of your sperm. So it is advisable that you store your sperm before you go for your cancer treatment, for instance, like testicular cancer or non-Hodgkin's disease, or even prostate cancer. Sometimes men do want to store before they undergo a procedure called vasectomy, or sometimes they want to store their sperm before they go off to work overseas, for instance. They want their wife to get pregnant. They may be going for a long duration of time, sometimes in the army or those who work overseas. They would like to store their sperm before going off to these areas. And men sometimes like to store if they have problem with their sperm, especially those with low sperm count. And we can actually store the sperm multiple times, more than once. Then we can collect the sperm and we can increase the number of the count of the sperm by storing it multiple times. So these are one of the reasons why sometimes they would like to store their sperm. And sometimes those patients with azoospermia, that means no sperm, they probably would like to store their sperm once we get it through a surgical procedure. For instance, we do a procedure called PSA, which extract the sperm from the testes. These are for those with azoospermia. And then we do it with multiple times so that we can collect the sperm and store the sperm for usage later in IVF for the wife. So people ask, well, is there any problem with storing the sperm? Or how do you store the sperm? It's quite easy for men. Usually, we will ask them to abstinence or do not take out your sperm for at least 2 to 3 days. Keep the sperm in, and then just produce the sperm through masturbation. And if they have problems with masturbation or uncomfortable with masturbation, then we can probably use a special kind of condom, which we have here, and you can have a sexual intercourse with your wife at home and store that sperm in the condom and bring it to the lab. And it is stored for we store the sperm for a few years to be used later in your treatment for IVF or other treatments. So I think there's not much to talk about sperm freezing. You may have questions after this. I think for now, I will end my talk here, and then we will take some more questions after this. Okay? All right, Michelle?
Hi, thank you, Dr. Hatta, for the very informative sharing. So let us start our Q&A session. So, hi, people. So do not hesitate to ask questions directly to our specialist now. It's your chance. So to clear up your own doubts. So we do have a question here. So it says, how long can we keep frozen eggs and sperm? Dr. Chong, can you please answer that?
Yes. For frozen sperms and eggs, actually they can be kept for a very long time. But in practice, we will freeze them for 5 years first. However, if our patients decide to keep it longer, we will also continue freezing for them. So it's like a 5-yearly renewal.
Okay, so our next question here is, what are the risks of freezing? Dr. Hatta, can you please clear this doubt for our patient here?
Yes, basically there's not much risk in the freezing. When it comes to freezing of the sperm is very strong usually. When we freeze it, usually it will survive the freezing process. However, sometimes during warming up, when we want to use the sperm again, uh, some of the sperm which are actually those are not strong enough, they may not survive the warming up process. This is also the same when it comes to oocytes or eggs. So uh, they may not survive the process and they may degrade or they may die during the process. But it's not very common, and also depends on the quality of the egg or the sperm prior to freezing. But otherwise, it is quite safe. There's no risk to it to freeze your sperm or your egg. The risks are very.
Oh, so thank you, Dr. Hatta, for clearing that up for us. So our next question here is there any age limit to use frozen eggs to achieve pregnancy? So Dr. Chong, can you please answer that for us since it's an egg question?
Good question, Michelle. I'm sure some of us have heard of the stories of women getting pregnant at the age of 60 or even 70. Yes, it's possible to get them pregnant at this age, but don't forget, at this age, it also comes with a lot of health issues and social issues for the family, for the parents and the offspring. So I think the general consensus will be to still provide fertility treatment to achieve pregnancy following the natural reproductive age of women, which normally ends at 50, early 50s, where we enter menopause. So in other words, it is still reasonable to treat them at the latest by the age of 50 or early 50s, but probably not later than that because of the health implications and social implications.
Thank you, Dr. Chong, for clearing that up. So our next question here is how to collect sperm when you do freezing.
Well,
So Dr. Please clear that up for us.
or how to collect sperm. Like I mentioned before, it's fairly simple. If you do like to collect, to do a sperm collection and a freezing, I would advise firstly to set an appointment with us. We like to meet you first and discuss a few things before we collect your sperm and store your sperm. The procedure is very simple. Basically, you just produce your sperm in a cup, and then we'll pass it to our lab and we'll freeze it. You can produce the sperm at home if you wish, because sometimes people are not comfortable to have it done in the lab. So, provided that you can bring the sperm within an hour to the lab, it should be no problem, because some people are more comfortable to do it at home. And for those people who are not comfortable doing masturbation, we have a special kind of condoms. Not the condom that you buy from 7-Eleven, no, because those are the condoms which can kill the sperm. These are special condoms which are provided by our pharmacy, which you can use and have sexual intercourse with your wife, and then collect that sperm, put it in a container, and bring it to our lab within 1 hour as well. So it's quite simple. Yeah.
Thank you, Dr. Hatta. So we have another question coming in. Should I Dr. John, can you please answer that for us?
Sorry, I can't get that. Can you repeat, please?
How many eggs should I freeze?
Okay, another good question. Usually, like I've mentioned before, the woman goes through hormone injections to help them to produce eggs. So the more the better, we can say that. So whatever follicles that have developed and ready to be collected, we will collect all these follicles and the eggs. So it also means that if we are younger, our ovarian reserve is good. So during one egg collection, we can manage to get quite a good number of eggs. But for somebody who is older, the egg reserve should be lower, and probably the amount also will be lower. So in other words, we will get as many as you can produce during that egg collection.
So I see. I hope this clears up a lot of questions for our audience. So thank you once again, Dr. Hatta and Dr. Chong, for today's very informative sharing. And to all audience, please follow our Facebook page and stay tuned for our next Facebook Live, where we will be giving more lucky draw winners. Thanks. Bye.
Bye, everyone.